Senator Menendez of New Jersey is recognized.
Thank you, Mr. Chairman. According to the Urban Institute, of the 16.1 million new household formations over the next 20 years, more than 80% of them will be senior households. Due to lack of affordable housing options and lasting damage from the financial and COVID crises, many of these senior households will be renters. Dr. Malinsky, what does this significant increase in senior households mean for our senior public housing capacity and the senior housing needs that Congress should prepare for?
Thank you, Senator. Right now, over half of households living in public housing are headed by an older adult, and we certainly expect that, given the statistics that you just mentioned, that will increase. That brings with it needs for, and also I should say that only 36% of our older adults receive the rental assistance that they're income eligible for. So as we see that number of income eligible groups, households grow, we're going to see increased demand for these programs for public housing, which does provide more accessible housing than other market rate affordable rentals, and also programs like Section 202 and project-based Section 8, which provides services as well, which are going to be increasingly important.
Well, HUD's Section 202 Housing for Elderly program provides seniors, as you said, with affordable housing options and service coordinators to connect them with additional services and supports they need to age in place, which is far less costly to us than the alternatives. However, the program has been severely underfunded for over a decade. In 2010, Congress appropriated more than $450 million for the construction of new Section 202 housing. The final FY22 omnibus that was enacted earlier this month provided only $199 million. That's an enormous cut when the population is going up and we're going the opposite direction. And the president's budget for FY23 asked for even less. So I've strongly advocated for more robust funding in years past, and I hope my colleagues will join me in calling for enough funding to meet the rising needs of older Americans aging in place. Bless you, Chairman. The aging in place at the end of the day is far more dignified, far less costly to us as a society. The shortage of affordable housing is crushing our seniors. In my home state of New Jersey, one Section 202 provider has waiting lists 8 to 10 years long to get into their communities. With wait lists that long, the sad reality is that some seniors may never have the opportunity to benefit from these critical programs. Mrs. Guzman, can you describe the struggles that AARP members face when looking for affordable housing?
Thank you, Senator Menendez. Yes, I can. Older adults are having a difficult time because the affordable housing options are just not available to them in their communities. And it's what they have to pay is putting a strain on their household budgets. And so what they need are housing options, a variety of housing options that can work for them to meet them at their income levels, whatever those may be. So we advocate for accessory dwelling units, which are smaller units that can fit on an existing property of someone's home. They could be attached or detached. That can serve as a place for someone to remain in their homes. They could stay there. They could rent out their larger home. They could also supplement their retirement income by renting that unit out. So there are different ways. There's also manufactured housing as well, which is an affordable housing option. But those need both of those housing options need to be allowed in various communities across the country. And with new or reformed zoning laws, communities can add those housing types to their communities so that older adults have a place to stay.
Mm-hmm. Well, the shortage of senior housing is only going to grow over time. According to the Joint Center, 31% of 65 to 79-year-old renter households in New Jersey, for example, spend more than half of their incomes on housing. A National Low-Income Housing Coalition report says, quote, older adults are at the center of our nation's housing affordability and homelessness crisis. Close quote. To me, that's a call to action. So, Dr. Malinsky, what has the Joint Center's research shown about the impact on the lowest income senior household of paying more than they can afford for their housing?
When this happens, there are cutbacks in food and medication and out-of-pocket spending on healthcare, less savings for retirement, less spent on transportation. People may be forced to make an unwanted move, which takes them away from their support networks, doubling up with family instability. And the homelessness crisis among older adults is growing. The numbers have gone up, especially among the younger baby boomers. And so we are concerned about all of these things, about displacement from one's community and one's home, and all the necessities that affect health and well-being that people forego.
Well, let me close by saying it's amazing in America that the choices are between putting food on the table, having access to your prescription drugs, and or the place that you're going to call home. And that's what these seniors are facing. We are facing both a housing affordability and a housing supply crisis. And without significant investments in successful and trusted programs like HUD Section 202, we're not going to be prepared for the coming wave of low-income senior renters. And I look forward, Mr. Chairman, to working with you on that question.
Thanks, Senator Menendez.